Welcome to CPEHR webinar on healthcare reform. I'm Peter Duncan with Hub International, and I'll be walking you through today's presentation on healthcare reform specific to small employers as defined by the Healthcare Reform Act, and we'll spend a little time looking at that definition. So let me begin and share with you. My first slide is just some general information about the law that was passed in March of 2010, and it goes by various names. Some you're probably very familiar with, such as Obamacare or the Affordable Care Act, ACA, or the Patient Protection and Affordability Act, PPACA. The unique thing about this healthcare reform law, it's so significant and wide-reaching throughout multiple agencies of our government, and its impact on current law is so significant that the three agencies are coordinating their efforts to provide regulatory guidance and understanding of the law's rules and regulations. The agencies are the Health and Human Services Department, the Department of Labor, as well as the Internal Revenue Service. I'm going to touch on a couple of key components of healthcare reform that really are the underpinnings of this legislation, and each one of these has a significant impact on how healthcare is purchased and provided to individuals as well as small employers. So the key points are: the law contains an individual mandate that requires all U.S. citizens and legal residents to have health insurance or pay a penalty. So this is a very broad, sweeping individual mandate that requires all of us to have insurance, and if we don't, there's going to be a penalty that we pay. We'll go into some detail about what those penalties look like. Coverage is guaranteed issue and beginning January 1st, 2014 in the individual market. This is a significant step to break down many of the barriers that have existed to purchasing health insurance for individuals. The third item is the large employer mandate. This requires that employers of 50 or more full-time equivalent employees provide health insurance benefits that meet the Act's minimum requirements, or they would be subject to penalties. Law also creates a state-based marketplace called the state exchange to provide information, access, enrollment support, qualification for subsidies to individuals, and it will also support the small employer purchasing platform called SHOP, S-H-O-P. The next key point is that the law implements significant premium credits and cost-sharing subsidies for low-income individuals. We'll spend a little time looking at what those subsidies are. And lastly, one of the major components of the law is the expansion of the eligibility for Medicaid, and in California we refer to it as Medi-Cal. This part of the law is going to provide access for the first time to some 17 million Americans nationally. In California, it's about 1 million individuals that will be newly eligible for Medicaid coverage. I'm going to take a moment now and talk about the individual mandate and the penalties that are in place beginning January 2014. So the law requires that individuals purchase health insurance, and if an individual does not have health insurance coverage, they are going to be subject to penalties. And these penalties phase in over the initial 3 years, and then they'll be indexed to inflation. In 2014, the penalty will be $95 or 1% of adjusted gross income, and that's the greater of. The penalty applies to individuals, their dependents, children. The penalty amount is half the adult amount, and spouses. Now, an individual is required to provide evidence that they had health insurance coverage for at least 9 months in calendar year 2014. If they had coverage for less than 9 months, they will be subject to this penalty. The penalty will be pro rata on a monthly basis, and it will be administered or collected by the IRS. So when you file your tax return at the end of the year, there'll be a section that asks for confirmation of your health insurance coverage, and you would indicate there whether you had it and for how long did you have it, and whether any penalty would apply would be determined at that time. Premium subsidies and credits for individuals. A large portion of this Healthcare Reform Act involves providing access to health insurance for low-income individuals. And I mentioned earlier there's a significant expansion of Medicaid. The Medicaid eligibility begins at 138% of the federal poverty level. Now on this slide at the bottom you'll see information about what the 2013 federal poverty levels are. These will adjust slightly for 2014, but currently for an individual, income below $11,490 would qualify them as, would be the federal poverty level. Their income at 138% of that number, which would be $15,856, income below that level qualifies an individual for Medicaid. Income below $32,499 would qualify a family of 4 for Medicaid. Amounts of income between 138 and 400% of the poverty level, and we've illustrated that range on this exhibit. For an individual, it's $15,856 to $45,960. Incomes between those ranges would qualify the individual for a premium subsidy, and the premium subsidy will vary based on the income level. The subsidy is greatest at the lowest level, paying almost 90% of the premium at the very lowest level, and then reduces as income goes up. And the subsidies are also available at income levels for a family of 4 between $32,499 and $94,200. Again, these amounts will change going into 2014 slightly, and the information will be adjusted as it becomes available. Now, employers that offer employees a health insurance plan that meets the affordable definition and rules of the Healthcare Reform Act would result in the employee as well as the dependents not being eligible for subsidies. Just to say that again, if an employer is offering an employee the opportunity to enroll in an employee benefit plan that meets the law's requirements, that individual is then not eligible for a subsidy. The individual is not eligible, nor any of their dependents. This is an important item to understand for employers so that they can help communicate to employees how the subsidies work and how the employer's plan being offered is an alternative to the subsidies. The affordable rules are pretty straightforward. The employer must offer a minimum level of benefits. The benefits must have a 60% actuarial value, and they can't charge the employee more than 9.5% of income. This sets the criteria for determining whether the employer's plan is affordable and whether the individual would be eligible for subsidies on the state exchange. So the next slide, we're going to begin to talk about the state-based exchanges and what they're designed to do. So the federal law requires that each state establish an exchange. They have the option to establish their own exchange, or they can enter into a federal-state partnership exchange, or default to a federally facilitated and run exchange. And we'll see in a moment that various states have selected to approach this in different ways. The exchange will operate as a marketplace for individuals to shop for health insurance, to get guidance and assistance in selecting plans, in submitting an application for coverage, and getting qualified for either Medicaid or for premium subsidies and credits under the Healthcare Reform Law. So the state exchange operates as an administrator of many aspects of the Healthcare Reform Law. providing assistance and processing applications and determining eligibility. The exchanges will be open for open enrollment October 1st of 2013 and will be fully operational by January of 14. On our next slide, we have a map, and this map indicates what each state has elected to do so far with regard to establishing an exchange. In the dark blue, states that have set up their own marketplaces, so far there's 16, including Washington, D.C. California, of course, is one of those. They've set up their own exchange, and it's pretty far along. 7 states have a partnership exchange with the federal government, and then 26 states have left it up to the federal government to put an exchange in place in that state. You'll notice at the lower right-hand corner of this slide that there's a logo for the Kaiser Family Foundation. This is an excellent resource for information about healthcare reform, including this information about state exchanges and what they're doing. So on our next slide, we see some information about California State Exchange. The name of it is Covered California. The website is up and running. You can find some basic information about the exchange and what it's designed to do in terms of helping individuals and small employers with their purchase of health insurance. Again, the exchange will be, open enrollment begins in October of this year, will run through March of next year. The exchange will also illustrate the principal benefit plans available: bronze, silver, gold, platinum. There will also be a catastrophic plan for children and young adults. Now, the metal plans have different values: 60%, 70%, 80%, and 90%. These are actuarial values and describe the level of reimbursement expected under the plan for health care costs in California. You can go to the exchange website and you can look up the plan designs for each one of these plans. California is requiring that participating health plans provide the same level of benefits in the exchange as they provide outside the exchange. We did learn this week that one of our health plans, Anthem Blue Cross of California, has elected not to participate in the small employer component of the state exchange. So they'll be marketing plans outside the exchange, but those plans will be regulated and will look very similar to the plans that are in the exchange. So individuals have the opportunity to enroll during the open enrollment. If they don't enroll during the open enrollment, then they'll only be able to enroll if there's a qualifying event, and they apply within 60 days. The last note on this page regarding exchanges is the requirement that employers provide all employees with a notice of exchange detail by October 1st of 2013. So by October 1st this year, every employer must distribute to employees the required notice of the exchange, and then make that notice available to all new hires. The federal government has issued a model notice. It's not too cumbersome. It's about 1.25 pages, provides some basic information about state exchanges and employees' access to information on the exchange. The next page and several pages are going to talk about some of the general provisions of the Affordable Care Act. One critical piece of the Act is the requirement for large employers, called the employer mandate, that requires these employers to provide health insurance coverage, and if they don't, they will be subject to penalties. So one of the things every employer needs to do is determine whether they're a small employer or a large employer relative to the guidelines of this Act. So I'm going to take a moment and explain how that's done. It's not intuitive. It's not how many full-time employees do I have. Well, if I have less than 51, then I'm small and I'm not going to be subject to the penalties. It doesn't quite work that way. So let's take an example. In the information at the bottom of this slide, we have an example of an employer with 35 full-time employees and 20 part-time employees. The full-time equivalent definition means that we must take into account the number of hours worked by part-time employees, and the formula is to add up their hours in a month. And in this example, we show 20 part-time employees, each working 96 hours in the month, for a total of 1,920 hours. 1,920 divided by 120 monthly hours gives us 16 equivalent employees. Well, the 16 is added to the 35 full-time, and in this example, the result is 51 full-time equivalent employees. In this example, this employer with 35 full-time employees is a large employer, and as a result is subject to the large employer mandate, which requires employers to provide coverage or pay penalties. Now, the penalty component of the law for large employers has been delayed from January 1st of 2014 to January 1st of 2015. So there's been a one-year delay, but determining whether you're large or small is very, very important, because there's a whole host of other reporting requirements and designation of employee status that are going to be required in order for an employer to fully comply. If you're less than 51 full-time equivalent employees, then you're not going to be subject to the mandate, employer mandate. So a few other general provisions of the Act. The Act tells us that a full-time employee is defined for healthcare purposes as an employee working 30 or more hours per week. It also defines for us variable employees, employees defined as not reasonably expected to work 30 hours or more per week. And it also gives us a definition of seasonal employees working less than 120 hours. These definitions are particularly important for large employers because each employee has to be categorized and tracked and reported on. Beyond that, the law requires that the waiting period for all size employers cannot be greater than 90 days. Now in California, we've passed legislation that reduces that 90 days to 60 days. So the requirement now in California is that if you offer a benefit plan, your waiting period cannot be greater than 60 days. Health insurance is now reportable on W-2s. Employers are also required to give employees 60-day notice of any plan modifications, and we're also required to use uniform summary of benefits of coverage. These are standardized benefit illustrations that will be the same nationally. So the criteria and structure of the information about the benefit plan will be uniform, will be the same structure no matter where you are in the country, trying to give some standardization and improve employee understanding of benefit. A couple of other provisions in the Act, two are on this page. The Cadillac tax, which begins in 2018. This is a tax of 40% on an employer's premium that exceeds $10,000, $200 per single individual coverage, and $27,500 for family coverage. Particular tax doesn't go into effect for a few years, but it is quite significant. For California, most HMO plans are somewhat under the $10,000 level today, but it would not be unusual to see PPO premium rates at or close to this $10,000 level even today. So this is something employers will need to pay a lot of attention to and track over time so that they're aware of what the tax might be should their plan exceed these values. The next item is the Healthcare Reform Act includes non-discrimination rules. And the Act is advising that a plan cannot favor highly compensated employees, either in its design of benefits or in its contribution. Now, the Act did refer to a section of the IRS code that details out the non-discrimination rules and penalties if your plan is discriminatory. However, those rules are a bit complex and found not to be very workable for a lot of employers. So the IRS has suspended the application of this rule until further guidance and regulation is issued. It was supposed to go into effect in September of 2010 and has still not been implemented. We suspect it will be implemented, but the timing is very uncertain. So this is another item that needs to be watched and followed carefully over time. General provisions regarding wellness. There are two types of wellness programs, and each has some implications under this under this law. A participation-based program is a program in which the employees need to just engage in the activity. Could be the completion of a health risk assessment and something along those nature. And employers are allowed to provide employees with rewards for participating in the program, and the amount of the award is not limited. The other type of wellness is an outcome-based, where the plan requires the participant to reach a specific health goal or a standard, whether it's cholesterol or body mass, and set premiums for affordability, and then can only reduce those premiums up to 30%. So the outcome-based programs can only be structured as an incentive plan. You can charge less, you can't charge more. The tobacco component of a wellness program can take that percentage from 30% to 50%. So this is a relatively recent ruling within the last month or two, and encourage employers, if they're operating wellness programs, to revisit how their plan is structured to make sure that it's going to be compliant in the future. Some of the requirements regarding the law and employer administration. Some of these items I mentioned, others I didn't, but let's go through this. One of the things that every employer must do is provide employees with a marketplace notice by October 1st. This is the state exchange notice. There's a model template available, needs to be completed, provide certain employer information, and then distributed to employees, and then made part of the new hire package. Along with that notice, there's a requirement that the COBRA notice be updated, and there's some new wording that goes into the COBRA notice relative to the state exchange as well. One of the things that we're advising clients to do is establish a healthcare reform waiver that would be completed by any employee not taking the employer's benefit plan. We think this is important because the individual mandate requires everyone to have health insurance or they pay a penalty. The employee, if the employee is given the opportunity to enroll in an employer's plan, we think it's important that they be reminded that they're subject to this individual mandate, they're subject to the penalty, they're subject to the availability of subsidies based on their decision, and to have them acknowledge that they've been given this information and that they signed a statement to recognize that. This helps the employer manage employees coming back at a later date saying, I didn't know or I didn't understand, I want to get into your plan, and you can't let them in because you're not in open enrollment period. And then they're subject to penalties. Summary of benefits, SBCs we spoke about, need to be issued, and beginning with renewals this year. If you're in an insured plan, this summary of benefits will be provided by your insurance company. And again, it's a standardization statement of coverage and describes benefits according to this new uniform statement. Plan documents and SPDs need to be updated to reflect healthcare reform laws. We know that the FSA health plan reimbursement amount is now being limited to $2,500. You need to make sure you're reflecting that in your documents. And of course, W-2 reporting of health premiums has also begun. One of the things that you should expect to see is some of the costs associated with healthcare reform, taxes and fees, largely that are required to be paid by insurance companies, some directly by the insurance companies, some by the pharmaceutical companies, some by the insurance companies on behalf of the employer. These fees are now starting to get built into health insurance premiums. And in 2013 and 14, the impact's probably 2 to 3% overall on health insurance premiums. One of the other things we advise employers to do is track state exchange in each of the states in which you have employees, so you can advise employees of what the exchange is in the state that they reside and how to access it for information about individual benefits. Employer administration continued here. Eligibility for benefits, for health insurance benefits, 30 hours per week. So most employers will need to make a modification to their eligibility definition so that they'll be compliant with the 30-hour work week requirement. Determine whether your vacation, PTO, or other benefits will match the 30 or you'll have something different. Update the employee handbook to reflect these changes, and if there's a collective bargaining agreement, be aware that that agreement is going to be opened and subject to healthcare reform provisions on its next anniversary. Employer reporting requirements begin in January of 2015. This is going to be a very important thing for employers. One of the main reasons employer mandate for large employers was postponed until 2015 was because the reporting requirements had not yet been issued and guidelines provided. So the federal government acknowledged that it's too late for 2014 to hold employers accountable for providing that information, pushed out the mandate for 1 year, but will issue this summer or early fall the reporting guidelines. The important thing about these reporting guidelines is that they will cover the period beginning in 2014. So once we know what the reports need to look like, once we understand the timing and frequency of reporting, we do know that the report is going to require that information about individuals covered by your plan will cover the period beginning in January of 14. And so it's important that employers keep an eye on this reporting requirement, contact CPEHR for guidance, certainly when the guidelines are issued and there's some clear understanding of exactly what the reporting is going to require and look like and when does it have to be done. Expected that employers will have to provide information that hasn't been provided to the government before. The next slide is our ref slide with information of the current 2013 federal poverty levels by family size. So this is a reference piece if an individual inquires as to whether they might be eligible for Medi-Cal or might be eligible for a subsidy. You can reference this piece. And you can also suggest that they go to the Covered California site, which has a calculator that individuals can use to determine what they might be eligible for. So healthcare reform is a significant piece of legislation. It's a large piece of legislation. It's touching almost every aspect of healthcare, health plans, employee benefit plans. There's a lot that an employer needs to know and understand about the law to either comply with its requirements, avoid penalties if you're a large employer, or just to make sure you have all of the requirements in place and you're communicating accurate information to employees. We encourage you to contact CPEHR. They're prepared to help you and your employees understand the Healthcare Reform Act and provide you with guidance and assistance in administering it. So with that, I'd like to thank you for taking the time to listen to this presentation. I hope you found it informative, and please contact CPE if you have any questions. Thank you.